Now, this week on the AM show, we'll be bringing you stories on the state of Ghana's emergency system. Today, the first part of the four-part series will focus on the system Ghana is running and the fact that our failure to replace the current emergency fleet is leading to more preventable deaths. Martha Kwentelakwa scrutinizes the emergency system in the following feature titled Emergency Exit.
The ambulance service is a crucial part of the health system in Ghana. In advanced countries, no clinic or hospital is without an ambulance, especially in deprived areas. The emergency service is, however, spread thin in Ghana. Not every health facility or what you describe as endowed has the ambulance to transfer patients to other facilities when their cases prove too difficult to be handled there.
Generally, if you hear the term ambulance service, the synonym is Emergency Medical Service, EMS. The reason many countries prefer to use EMS is just to let people understand what the whole system is about.
Stephen Ajiman is an EMT driver. He tells me he joined the service because he recognized his skill and passion for driving. His foremost concern is that commercial drivers put ambulance drivers' lives in danger.
The most dangerous part of it is sometimes the vehicles on the way, the truck drivers and the taxi drivers, including other private drivers, sometimes if they are hearing the siren, they don't want to give way for the ambulance to go. So sometimes if you are not careful, before you realize, you involve yourself into accident.
The speed of the ambulance has often been of concern.
Yeah, sometimes, normally because of some of the condition of the patient that is inside the ambulance, we need to get to the hospital quick for them to attend to the patient. Yeah. So that's why sometimes you can see an ambulance run with a speed.
There's a speed limit, but most of the time when you are far, you could see that maybe the ambulance is speeding. Yes. But they have a speed limit that they are not supposed to exceed, that irrespective of the patient's condition.
No, we have categories of emergencies. The category A emergencies are emergencies that you have to go with a siren because they are life-threatening, a case of life and death. And the reason sometimes you may see the ambulance blaring away from the hospital is when they are going to the facility.
This ambulance driver, who prefers to remain anonymous, just brought a woman in labor to the Greater Accra Regional Hospital. He receives another call back to Medina because there is another emergency that needs to be transferred. To put our responsiveness to test, we decided to trail the driver. Though the world standard requires that an ambulance spends less than 10 minutes to or from an emergency scene, this ambulance spent 19 minutes from the Greater Accra Regional Hospital to the Opebia Junction. This makes just half of his journey. Too many emergency cases do not get the opportunity to be transferred in an ambulance as the fleet is inadequate to meet the needs of those who perhaps need it most.
To get an efficient EMS system, sometimes it's cost capital intensive. The reason is that apart from training the paramedics, you also will need vehicles every 5 years. Currently, there are many districts which still don't have the system yet, so we are still gradually increasing.
To bridge this gap, many people in their time of emergency don't even bother to reach out to the ambulance service. A commercial or in some cases private vehicles are the alternatives. On one of my rounds in the course of putting together the story, I met this family at the Korle Bu Teaching Hospital. It was past 9 p.m. on a Friday evening. This woman has brought her critically ill son to the Premier Hospital for attention. Unfortunately, she was greeted with a no-bed response. She was asked to go to the Greater Accra Regional Hospital, but there too, she was told there was no bed to admit her son. Not even her pleas would touch the heart of health officials. She has returned to Korle Bu with her son to plead for his admission, and the taxi driver, who has been patient for the last 2.5 hours, cannot continue to do this favor because he is certain this woman cannot pay his fare even if he charges per the time and rounds he's done.
Most of the time they will call and then they will tell you they've made all the necessary arrangements. You can call the receiving end. They will tell you, yes, we have received a call from them, but we can't assure you of the bed.
Really?
Sometimes they will tell you, oh, you come, we are aware. The ambulance will get there, and the only thing they will tell you, they don't have bed. So they have to detain the ambulance trolley.
So I witnessed one of such complex situations at the Korle Bu Teaching Hospital when a case was referred from the Pantang ambulance substation.
We were dispatched for an emergency at Legon Hospital. So after picking the patient and coming to the referring hospital, that's Korle Bu, they told us the arrangement they had made and the bed that was reserved for us had been given to somebody just 10 minutes before we got here.
About 90% of the calls that comes are prank calls. And then it's most of the time deprive a true call to come true.
Whilst conducting this interview, one of the prank calls came through. Commercial vehicles, especially taxis, have become the major means of transferring patients who need critical care in place of an ambulance. But in one of the instances I'm about to narrate, the story turned fatal. On one Saturday evening in February 2017 at Tetegu near Weija, a man, his wife, and unborn baby lost their lives. The story started when a woman in labor was referred to the Korle Bu Teaching Hospital when health officials at a clinic at Kaswa realized she had complications. In the absence of an ambulance at the clinic, the husband made a difficult decision to convey his wife in the company of an aunt and a cousin to the Korle Bu Teaching Hospital. But that journey turned fatal. The man who was driving, his wife in labor, and the unborn baby all died in an accident at Tetegu.
Every health facility is supposed to make their own arrangement to have an ambulance. They call it facility-based ambulance system. That is different from the National Ambulance Service. The facility-based ambulance system ideally is supposed to be a vehicle placed at the facility and ready to transport patients to higher facilities, especially when they know they'll be referring cases. So my advice is any hospital that knows that it doesn't have the capability to attend to all cases should be able to have their facility ambulance for the inter-hospital transfer. Currently, what we do is that we provide both the inter-facility transfer and then pre-hospital emergencies as well. Yes.